You know, we get people coming from all over, and we're like, well, there's one down the street. Well, you know, so this is my reason for asking, because I can see the future of this. I think it's awesome, especially for myself, because I'm a person that travels and try. To me, this would be an app that I would have on my phone whenever you develop it.
So
but you said there's a website.
Coming.
But you said there's a website we can go to, correct?
All right. You can go to c2go.com
Okay.
and find a list of all the local businesses in the different categories that you can find on the kiosk as well.
Two things I want to say in closing. One, thank you for coming back home. And thank you for bringing an idea like this home. Because we have visited places like Austin, Texas, and the mayor left Austin, Texas, and we went. And Isaiah, I think you were on that trip too, where we saw where the younger generation today came together, new inventors, new businesses came together, and they had just one room, and it says, quit your job. That's what their sign was. And it was an incubator for small businesses to start. And when I looked at this, that's the first thing I thought, and I wanted to publicly congratulate you for coming home and bringing technology, and let's sell our city. We have a wonderful city.
We're trying to create new jobs, too.
Oh, yeah. And, and people don't know, advertisement comes from yourself, your word of mouth. You meet someone in there and you say, yeah, you ever been to Columbus? Well, we have A, B, C, and D. So close my soap opera. Thank you. I just want to know how these small little shops that we have unique coming up, they're popping up. They're wonderful. I would tell you one, but I always mess their names up. But I'll tell you offline. They're the best breakfast place now in Columbus, Georgia, downtown.
Right. So we want to know that, and we want to get them out there and promote it.
So that's why I say that, because of that. I'm thinking of them especially. Their little breakfast shop is like if you were in Florida, you walk in and you think you're in Florida, but you're in Columbus, Georgia.
That's right. So our tagline is Connect to Enjoyable Experiences. There's a lot of enjoyable experiences going on in Columbus. Some are hidden, some are out in the public, but how can we bring all that together and connect everybody, whether it be visitors or locals, to these places that we have in town?
Well, thank you very much.
Thank you.
Thank you.
I'm going to call on HR Director Retha Hollowell for the benefits manager update and health insurance update.
Good morning again, Council. There are two things that I would like to accomplish this morning. One of them is to formally introduce the benefit consultant that has been selected back in July. They were here in July for the confirmation vote, but you didn't get a chance to really hear from them about their company, who they are, and get a more personal feel for this company that we've asked to assist us with our benefits. So that's one of the things I'm hoping to accomplish. Another thing that I'm hoping to accomplish is to do what you asked us to do some time ago, and that is tell us what you're thinking in terms of the direction that we're going with health care and our benefits. And that's the second part of this presentation here this morning, is to tell you what we're thinking and to share with you what we believe will be a good roadmap in terms of our health care benefits. So this is not something that's set in stone, but it is us sharing the direction that we anticipate going as it relates to our health care benefits, and certainly to solicit your feedback and say, oh no, don't go down that road, you should go the other way. And as we talk with you, we'll also, we are kind of getting a nod from you that this is okay, this is the direction that we think we want to go. We'll certainly be meeting with the Employee Benefits Committee and have as many focus group meetings as we think is appropriate to share with the employees. The handout that you have may not be beneficial to all of you all, but it hopefully will be beneficial to some of you all. That is a document that that we've attempted to put in every employee's hand as we've started our open enrollment season. As I mentioned to you, it started October 5th. It'll go through October 23rd. So if by chance you're on our health insurance plan and you think you may want to make a change during this enrollment period, now's your opportunity to do so. But that enrollment guide, which was prepared by our benefit consultant, Shaw Hankins, is a very detailed guide that tells you about every one of your benefits. And it gives you an opportunity to take it home, even with your spouse or with your children, and say, let's go through this and let's make sure that everything is okay and that we don't need to make any changes during this open enrollment. And if by chance after looking at it you say, well, I think I need to talk to someone about that, there's also a schedule in that open enrollment guide that lists all the dates that you can go to one of the facilities, whether it's here at the Citizen Service Center, if it's at the Government Center, it's at Parks and Rec, it's at one of our public service. We've got a number of dates and places in there that you can go and actually sit and talk with an open enrollment enroller and just have a one-on-one with that person and go over all of your benefits and have them answer any questions that you have. If you say, well, I don't think I really need to go in and talk to someone, maybe I can just call them on the phone. There's a 1-800 number to the call center number, and I apologize, it doesn't say 1-800, I believe it's an 844 number, but nevertheless, it is a toll-free number that you can call and ask any questions related to your benefits and get a response to that. So that's the purpose of that guide. And like I said, it may be something that you just want to take with you. Without any further delay, I'm going to ask the representatives here with Shaw Hankins to come, introduce themselves, and they're also going to talk to you about this roadmap in terms of our health care benefits that we're proposing that we go down, and certainly will entertain any questions and comments that you have.
Again, my name is Scott Hankins, and I have with me here today Wes Ross, who's one of our consultants. Another one of our consultants, Todd Hooper, is actually at your Public Works Department this morning, or this afternoon, I guess, making sure that process goes smoothly. And Tammy Starkey is here also. She's your Senior Account Executive. You have a team of about 7 or 8 individuals that are assigned to your account, but the faces that you'll see the most are here today. I'm going to ask Wes Ross to go through the proposed 5-year plan, and then Tammy's going to speak for just a minute about compliance.
Well, I would like to say, again, I'm Wes Ross, consultant from Shaw Hankins, and I would like to just say I know we've been here when we got introduced and were awarded the account, and then also another time on the Medicare piece, as well as some other projects that we're working on. But thank you very much. It's an honor to represent Columbus Consolidated Government. We're very appreciative of that on behalf of myself and our firm. Like Scott just mentioned, there's several things that are ongoing right now, and just to kind of further test that water a little bit of what all is going on, we have developed the Benefit Resource Center, and that Benefit Resource Center has all of your enrollment information, the guides that you currently are looking at there, short videos on each product in which your employees can go online. They can actually view these videos that break down the medical coverage, the dental coverage, the vision coverage, each coverage, so they can understand their benefits better. We'll be working on some actuarial modeling in which we're going to be helping to project your budget and finalize your budget. Also, the online enrollment, as Scott mentioned, is going on right now, and last week it started. And also the different layers of our firm that we talked about. We were first awarded this case from the call center to the client service representatives, to the account manager, to the account executives, to consultants, different layers of checks and balances to ensure we are running as efficiently as possible. We're very fortunate. We started in 1963. We have over 40 employees, 6 locations, and we now have 60 public entities. We also have a large amount of private sector clients as well, but those 60 public entities show we know what we're doing in this sector. So what I want to move into right now is just a quick snapshot of where you stand financially as far as your claims are, and then we'll just briefly go over the plans and then introduce that 5-year roadmap. Cost of health care. So as you are well aware, fiscal year 16, Columbus Consolidated Government budgeted $5,650 per employee. Also in fiscal year 12, the City Council adopted some cost-sharing ratios in which the active employees was a 70-30 split, pre-Medicare eligible retirees was 50-50 split, and then those that are Medicare eligible retirees, Columbus Consolidated Government funds 25% of the fully insured Medicare Advantage premium that's with the United Healthcare right now that we spoke about a couple meetings back. So let's look at how your plan's running from 2013-14 to now. In 2013, you approached about $15 million in medical claims. Now, we break this out into three parts: medical claims, prescription claims, and then we look at total claims together for your health care cost. So from $15 million in 2014, this is calendar year, it jumped to 17.6, which represents about a 17% increase. And then here you are now, year-to-date through August at $7.9 million. Now, I'm going to talk in just a few moments on what contributed to that increase, but that's just a snapshot on your medical claims. The prescription drug plan ran a little bit better there because it's currently at 2013 at $5.9 million. The jump to 6.3, which is about an 8% rate increase. And then also year-to-date at $4 million. So when we look at this on a cumulative basis, just make sure I follow along here. Look at a cumulative basis, you're looking at $20 million in health care expenses in 2013, 20.9, almost $21 million. In 2014, on calendar year basis, that jumped to $24 million, and then year-to-date, 11.9. So what contributed to that increase? Why did that sudden 17% spike happen in calendar year when you're looking at your medical claims? And what we found out is when we dug a little bit deeper into this, we discovered that your high claimants is what's going on. In 2012, 13, and now in 15, it's running as expected. But in 2014, we had a definite spike in your high-cost claimants. When I say high-cost claimant, that's any claimant that goes above $50,000 is what we're looking at here. As you can see, you had a substantial amount of high-cost claimants during that time. How's your plan running? Just another way to look at this. If you look at it in comparison to 13, 14, and 15, currently in 15, you're running slightly under where you were in 13. So that's very good news. We're running definitely in a better position than we were in 14. And then also just to kind of give you some numbers on year-to-date. So these are year-to-date numbers, and this will lead into this next graph. Calendar year 2013, your medical claims were about 9.5. Your prescription drug claims were 3.9. And this is through August, 2013 through August. So totaled at $13.4 million. In 2014, we had a spike of $11.7 million in medical claims, prescription drugs at $4.2 million, which brought the total to about $16 million. In calendar year 2015, medical was 7.9, $4 million to about 11.9 or $12 million. So this is very good in that you're under where you were in 2013 by almost $1 million when looking at this. So if you remember, fiscal year 15, the City Council had budgeted for a $4.5 million deficit for fiscal year 15. According to our trend lines, you'll see, except for in November and December, that spike there for those large claimants is trending downward. So we don't foresee that deficit being quite at $4.5 million. There's still going to be a deficit, but it won't be a $4.5 million deficit. We foresee that being a little bit better, okay? And we're going to talk in a few moments about some things that we feel that can maybe help eliminate some of those large claimants and catch them before they hit that plan and become a $50,000 claim against your health care plan. So the current health care offering, I'm going to skim through this very quickly.
The Mayor Pro Tem has a question on that point.
Okay, great.
Are we going to get copies of these slides?
Yes, we can. Yes, we'll be happy to.
Because,
yes.
Yeah.
you know, I have old eyes, and I cannot.
And I talk fast, and I have an accent.
No, it's not the talking. You can't see the print, the color
it's hard
of the,
to see.
You can't read it.
Yes, we will definitely send out a copy of this to everyone, if that's okay.
Thank you.
Thank you.
No problem. So the current plan designs, I'm going to go over this fairly quickly. And the reason for that, these are just your current plans that have been enforced. But as you're well aware, you have the Health and Wellness Center plan option, which is it's actually a blue open access POS plan that's coupled with that Health and Wellness Center, which is an incredible facility, state-of-the-art facility that we won't do nothing but expand on that we'll talk about in a few moments. And there's certain privileges that you get if you go to the Health and Wellness Center in which you don't have copays for primary care physician and prescription drugs, generic prescription drugs. The other plans that are available is a HMO, truly a gatekeeper plan. What I mean by that is you select a primary care physician, that primary care physician refers you to your specialist. And then you also have a Blue Open Access POS, which is a point-of-service plan that has in- and out-of-network benefits, and you don't have to have a primary care physician. Your responsibility is that you go in-network, because if you go out-of-network, you're going to pay more. And then you have the out-of-area PPO. The Medicare Advantage plan, we spoke about that briefly. Currently, the renewal was at 6%. We met with the committee. The committee decided they wanted to take the first alternative that actually reduced it to a 1.5% rate increase, slightly increased their exposure from $1,000 of out-of-pocket exposure. Medicare operates a little bit differently than traditional plans, to a $1,500 out-of-pocket exposure. So that's some of the things that we've done thus far. So 5-year master plan, how do we get there? So we know where we want to be, but we want to decide how do we get there and that roadmap to getting there. And that's controlling health care costs. And also the key we want to do, starting in 2017 and beyond, is focus on wellness. We want to focus on wellness and expand on the current initiatives and promote healthy lifestyle to all employees, regardless of what plan they're on. We want to have healthy lifestyles for all those employees and help stabilize health care costs. How are we going to get there? And this is where we got to test the political landscape, and we're learning our way around the political landscape, as we're all aware, and I'm kind of joking there a little bit, but the health risk assessment is one way, an HRA. The second way is through biometric screenings, and we'd like to see that done to all of your employees. Now, we know we probably won't get there year one, all your employees, but the more people we can get to fill out that health risk assessment and get their biometric screenings done, which is nothing more than you would have done if you went and got an annual checkup, the better we're going to be. Because what are we going to do with that information? We're going to stratify that health risk, that information, and determine who are your health risk factors and your high risk factors. And then we're going to take those employees that have the most high risk factors, and they're going to meet directly with a health care coach to improve not only their health, but to lower the number of risk factors and the severity of those factors. And so the idea there, again, is the Health and Wellness Center is the platform for the wellness program. And I can't stress that enough. The Health and Wellness Center being the platform for the wellness program. 50% of people that become a high claimant, last year they didn't know they were sick. So that's why we think it's imperative to get those health risk assessments, those biometric screenings, get our annual checkups done so we can identify those high risk before it becomes a high risk claimant, if you're following me there. And it's above that $50,000, so we catch some of those claims before they happen. What we want to do, though, is after we stratify your population and those health coaches are meeting with that high-risk population, that's where the project begins. You start out there, providers working year-round with your high-risk participants, and then depending on the resources, employees that complete an HRA and biometric screening, they use the facility in the Health and Wellness Center for the acute care, because there is incremental savings in acute care usage of that facility. The Health and Wellness Center, you can go in there for treatment of a common cold, and it's a benefit from the employees I mentioned before because there's no co-pays. It's also a benefit for the prescription drugs, and there's incremental savings to the city by the acute care. But really, we want to push that ROI up and make it a true return on investment and by a long shot there, and do that by catching those. We're being a preventive center that catches risk factors before they become high-risk claimants, if you're following me there. Again, the Health and Wellness Center, we're going to focus on becoming preventive care rather than acute care, and it's for well-being of all employees, not depending on which plan you take. We'll review the staffing hour. We constantly have to look at this for the logistics of the Health and Wellness Center. We want to keep it state-of-the-art. We want to keep it one of the best facilities in the state, and we do that by making it the most efficient and most effective facility there is. Continuous analysis on the Health and Wellness Center is mentioned there for optimal improvements. So 2016, here we are now. 2016, what did we do? We did not make any changes to the active or the pre-Medicare eligible retiree plans. One thing we have recommended doing is transitioning to pharmacy benefit manager, or your PBM. And I know there's further discussion to be made on that, and we'll get there. But that is one we would like to do, is transition to a PBM that specializes in this area, that has lower ingredient costs. As I mentioned that last meeting, the lower the ingredient cost, the lower the employee is going to pay, as well as the more the city is going to save. And also develop cost structures, develop additional cost structures that measure for cost control measures, that will not adversely impact your employees. What I mean by that is step therapy, or possibly a starter dosage. Before someone puts you on a medication, let's begin by a starter dosage where you get a 90-day supply of that, or a full month supply. Those are some of the things, especially for those high-cost drugs. And then implement the ProCare RX Smart copay plan. And what this does, it utilizes manufacturer's discounts and through a manufacturer's discounts on certain drugs, it can save the employee money. It can almost eliminate the cost there, or a large portion of it. And then it can eliminate cost to the city because as a self-funded plan, you're paying that claim. So first quarter, Shaw Hankins is going to develop, and this is where the actuarial modeling comes in our projections for your budget. Shaw Hankins will develop and present claims experience for 2015, and we're going to project calendar year 2016 and fiscal year 2017. That's done there in the first quarter. Planning begins second quarter for that 2017 plans, and then we want to put in a educational meetings and a communication overhaul during the third quarter, so all employees are well aware of any changes. That's employees, active and retirees, and we will make sure that everyone is aware of the changes that may be taking place. 2017 action plan. So this year we're more of holding tight on the current structures. We're beginning to analyze a lot of data. Wellness is everything that we're talking about. And then in 2017, the expansion of the Health and Wellness Center to all employees. And that's very important. Right now, it's whether you take a Health and Wellness Center plan, you have access to the Health and Wellness Center. We want to open that door to all employees. And we want to do so where they complete the HRA and the biometric screenings. Those are two key factors. And that's just as you would do if you went to any other doctor. You always complete a risk assessment. What prescriptions are you on? What allergies do you have? Things like that. And then also the biometric screenings. We also would like to simplify the health plan choices. And we want to do this a silver and gold option. The state currently does that. You have bronze, silver, gold options. So we think we want to simplify the health care options to having a silver and a gold option plan. Eliminate the HMO, because if you make some minor tweaks to the POS plan that's available, I don't think there'll be a need for that HMO plan, that gatekeeper plan. It's a little bit dated plan. Also replace the PPO plan. Again, a PPO plan is a very expensive plan. It's an out-of-network plan. Well, the point-of-service open access plan actually has a PPO wrap that can protect those individuals that go out of state. So those are some things you can do to save incremental savings on your health care plan just by updating your plan designs. Also, as we move into 2017, we want to consider the consumer-driven plan options. You probably heard something about this, maybe in the news. Consumer-driven plans, higher deductible health plans, are becoming a real thing now. HRAs, HSAs, that's not to be confused with the HRA I talked about earlier, health risk assessment. This is a health reimbursement arrangement. Also, there's HSAs, health savings accounts. We're going to analyze all of these different plans and bring to you what we feel are the best plans for that silver and gold option. And then also benchmarking analysis. Where do you stand in comparison to other public entities in the state of Georgia, in the Southeast, in comparison to private sector employers that are equal size? We will make sure we do that benchmarking analysis to ensure you're in the most competitive landscape you can be in. In-depth review. Some of this will be repetitive, and I'm going to say this, but the in-depth review of the prescription drug cost savings, we have to really focus in on this. Prescription drugs are constantly changing. The formularies are constantly changing. New drugs are coming out that are extremely expensive, but also new generic alternatives are coming on the market that are not expensive that much. So we want to make sure that your employees are taking advantage of that landscape, and you as a city on a self-funded plan is paying for the least amount that you possibly can for those prescriptions. Analyze the value, and Tammy's going to talk about this a little bit in the compliance section, but analyze the value of the tobacco use surcharges and the spousal surcharges. Review the voluntary benefits to ensure that they supplement the core benefits package, and that's very critical. There's so many new benefits that are out there in supplemental benefits. Critical illness, cancer, whole life, hospital indemnity, accidental plans, all these different things that are out there that can help supplement your employees and make their plan whole. We will make sure we marry those two so that way they fit and coordinate one another. Also review, there's a lot of talk about this right now, and it's still a little bit preliminary, and we'll see what happens with the elections, as this could be one of the first things that is targeted. But the review of the Cadillac tax implications, Tammy will talk a little bit about that, but there's some things that if this does roll out, we need to make sure that we're making incremental changes to your plan to avoid that excise tax. 2018, now that we've developed the plan structures in place, we're really focused on wellness and catching these risk factors before they become a high-risk claimant. Now we dive into a medical claims repricing. We think it's a good idea every 3 years to do a medical claims repricing in which you determine which carrier is giving you the most discounts on claims. Through our experience and through other entities not too far from here, Blue Cross Blue Shield is definitely the place to be right now as far as discounts on claims. But we still feel it's a good idea about every 3 years to run that analysis to ensure that Blue Cross Blue Shield is the most competitive place. Explore direct contracting options. What I mean by that is currently going on at your Health and Wellness Center, but let's say, for instance, in Northwest Georgia, in Marietta, and just on the outskirts of Atlanta, a Piedmont WellStar plan became available, in which you could access those hospitals through a health care plan. Well, if something like that unique happens here in Columbus, we want to make sure we're on top of that and we can explore those direct contracting opportunities to save more money. In-depth review, again, I said that before. Every year we're going to review that prescription drug plan, and we're going to focus on the most competitive plans available in the marketplace. These plans changes every single year. There's new plans, new designs, and we got to make sure, that's why we're here, to make sure we offer you the best plans that are available in the marketplace. I'll extend this out to 2019 now. I know that's getting a little bit far out, but still, it's very important. Now we want to look at a prescription drug claims repricing. We did a medical claims repricing. Now let's do a repricing on your prescription drug plan to ensure you're with the best vendor as far as your prescription drug go. Again, in-depth review on those prescriptions, ensure, once again, that we're keeping the drugs that we need on the plan or off the plan. Conduct a RFP to select a claims audit vendor. What does a claims audit vendor do? They take about 200 of your CPT codes. That's how you're coded when you have a primary care physician, specialist, emergency care, emergency room, inpatient, outpatient. You'll get a list of CPT codes that come behind that. What they do is take about 200 of your CPT codes that are highly going to be miscoded and identify if there are any miscodings. And if there are, they will actually go out further and review more in depth on your plan to ensure things are being coded correctly. So that's something new that we want to focus in on to make sure you are getting the best bang for your buck. Also focus on maintaining the most competitive plan designs. Again, I've said that. Benchmarking analysis, we've talked about that. Making sure, I know it said it 2 years ago, according to this, 2017, but 2019, every 2 years to do that benchmarking analysis to ensure Columbus, Georgia has the best benefits plan they can. And then 2020, we're really getting extended out here when you look out this far. 5 years out, you know, this healthcare world could change a lot as it's changed 5 years ago from now. But again, continue to focus on plan designs, continue to talk about the well-being of your employees and driving home that wellness plan. In-depth review of your prescription drug coverage has to be done every year, and continue to develop cost control strategies on your plans to stabilize your health care cost. Now, Medicare retirees. We had a conversation on this earlier. Currently, United Healthcare is the most competitive carrier. There was a company, Aetna, that was fairly competitive at the time, but it just wasn't as competitive as United Healthcare. Every year, we're going to market that plan to ensure, and we'll present that to the the retiree committee, and we will make sure that the Medicare plan is the best possible vendor available. We'll also look for new and unique ideas. I know a couple years back there were some unique strategies. The retiree exchange that was brought to the table, I know there's a lot of conversation around it. It didn't go forward, but those are the type of things, as they come out, we're going to introduce them to the committee, get their feel for them, and present to the council. And then also, anytime a federal or state regulation comes down that's going to impact the retirees, we want to meet with them immediately. And there are some things that will be coming, especially as that Cadillac tax rolls out. There's some things that we could definitely have to talk about as far as plan changes and designs. Nothing as of right now. And then the final thing is healthcare reform. Now I'm going to turn over to Tammy Starkey, but before we do that, any questions on any of the healthcare pieces, if I may?
Yes, we have Councilor Henderson to start.
Yes.
Thank you, Mayor West. Appreciate the presentation. Very, very comprehensive. You do talk fast, but I think I kept up with most of it. One question. Obviously, you guys have recognized one of our biggest challenges, and that's to try to get more of our employees utilizing the Health and Wellness Center. I think that's the most significant opportunity for us to impact the wellness and to cut down on some of the larger catastrophic type claims. In the past, to try to incentivize them to use the health and wellness, we have told them they can continue to use their physician, their primary care physician that they've had for years, but it will cost them the $50. It's like an out-of-network fee, I think,
yes, sir,
for the copay. Whereas if they utilize the docs that are there now, there's no charge. But if they want to use theirs, they can maintain the health wellness plan, but they can still sort of either wean themselves off of their primary care, or they can just continue them if they've got some ongoing issue. That's going to be maintained in place?
Yes, sir. And that's a very important piece, is that employees have that option, that with those two plans we designed, that they can utilize the Health and Wellness Center, but they can still utilize their primary care physicians. Now, they may pay a copay for doing so, where they have the incentive to go to the Health and Wellness Center, but they do have the right to keep that physician.
Well, and I know I harp on this, and I understand the sensitivity and the hesitancy on some of their parts to try to migrate over there because they've got children that may need to see specialists, and they're worried about it, and there's so many of them that don't really understand it. But to me, from a fiscal perspective, it's potentially the biggest impact. And physically, for our employees, to have a healthy workforce and do the best by them so that they live longer and they can hang around with their families longer. I just think it's I hope there's some other things that we can do creatively to try to get them to slowly migrate over there.
Yes, sir.
But thank you for the presentation.
Absolutely.
Councilor Barnes.
You do talk fast. And it was led, if I wasn't familiar with the things you're saying, I think you had something up your sleeve, but you don't, because a lot of the things that you talked about, I realize that you're very cognizant of, and you're definitely going in the right field when you talk about the biometrics.
Mm-hmm.
I like the fact that you're reviewing the formularies.
Yes, sir.
The emphasis on cost saving from generic drugs,
Mm-hmm.
which is the hardest thing I have to cope with in the community, trying to help a lot of the seniors, letting them know that you don't have to worry about the brand name. If it's generic, it's just as good. It may have some things in it, buffers or whatever, but it's
Right.
just as good, And would you revisit the issue with the point of service and the PPO? Go through, because I was with you, but you took a quick turn.
Yes, sir.
I want to be sure I'm on what you're saying.
Okay, so
with this here.
Here's your current plan designs. You have an out-of-area PPO.
Gotcha.
Well, a PPO is the most expensive health care plan when you look at it from HMO to POS to PPO.
Right.
Well, Blue Cross Blue Shield currently has an open access POS plan, so it has in and out of network benefit for the state of Georgia.
Gotcha.
However, if you go out of state, it has a PPO wrap
Gotcha.
that allows employees to go there, and that plan is cheaper than the PPO.
I like it.
So that's how we.
That's the only thing I wasn't up
Yes,
with.
sir.
You went I think you ramped it up to turbo speed when you went through that. You
I
understand?
do want to apologize. I'll work on slowing it down.
No. And this is not a criticism of you.
Yes, sir.
Because some people do talk quick, but a lot of the things that you were saying are factual, and I like.
Yes, sir.
I like the forward thinking and
Thank you.
the thinking outside the box, which I know you've done. I mean, you wouldn't be able to do some of these things if you didn't think outside the box on some of the things that you're talking. So I like it. There's no criticism of you. You're very knowledgeable.
Yes, sir.
And I know there's a lot of material. Part of it, though, probably was the fact that you can't, when you can see small right now, some of the individuals who don't wear glasses might be having a little bit of trouble. But when you're wearing bifocals like me, I'm trying to go like this here. I'm not saying yes to everything. I don't want to get a crook in my neck. You understand? But I like this. I like everything that you're saying, and the emphasis on wellness and the constant checks and evaluations are extremely important. Let's set cost aside. I'm talking about the long-range health of individuals here. This is
I think that statistic where we said that 50% of the people don't realize they were sick last year and they become a high claimant, that is just speaks in volumes.
Bingo.
Yes, sir.
And that rings a bell with me. So thank you so much.
Thank you.
It's really such great information, and I rarely take PowerPoints from council meetings. I just keep them digitally if I want to refer, but I very much would like to have this one. So
Yes.
anything else? It looks like we have no more questions at this time.
Great. There's one more slide on health care reform
Okay.
that I'd like Tammy just to briefly touch on.
A large part of Shaw Hinkins' role as the benefits broker for Columbus Consolidated Government is to make sure that you are up to date with how do we stay in compliance with the Affordable Care Act and what impact does it have to our health plan and the cost of that plan, with any fees that are enforced or any penalties that could be enforced if we are not in compliance. So part of that is making sure we're providing our members and employees with the proper documentation of our plans. So that's going to be in the summary of benefits and coverage, or you'll hear that referred to as an SBC. So it's a very specific document, has an format that we have to follow by, and so that has to be provided by the first day of open enrollment. So that is available for all of your employees on all of our communication avenues when they sit with a benefit counselor on their benefit enrollment portal. So that is available for the 2016 plan year. Also keeping in mind as we set budgets and we set our funding levels and employee contributions for the healthcare plans, what fees are going to need to be included in that. And so part of that is going to be the ACA reinsurance fee. In 2014, that amounted to $387,000. So that for 2015 will be $44 per member per year. So that's per covered life on the plan, employees and dependents that are enrolled on our medical plans. And then for 2016, it'll be $27 per member per year. So that's something that we'll work with Columbus on developing what measurements do we use to come up with what fee is due for the year and assisting with filing and paying that fee. Also, the PCORI fee was paid for 2015, $12,500 projected for that. That is set to stay the same in coming years, but we'll continuously monitor that because that is set year to year. We also will monitor any changes or developments in the Cadillac tax. The Cadillac tax is imposed onto employer plans, not based off of the value of the plan or maybe how low your deductible is or how low your copays are, but the cost of that plan. So really the funding of that plan, and that can be driven by the cost of your claims, the value of the benefits, or even the demographics of your group or the network that you're in. So that's something that even though we may think, well, we don't have a Cadillac plan, our employees are paying a deductible, they're paying copays, as we monitor the cost of that plan, we could hit those thresholds. And if we go over the certain thresholds for individual or family coverage, anything above that amount would be a 40% excise tax charged back to the employer group. So that's something we definitely want to avoid if and when the Cadillac tax does go into place, and currently it's set to go into place in 2018. We also continue to make sure we're in compliance with the out-of-pocket maximums for our plans. So year to year, that maximum is changed, increased for inflation of medical expenses, and making sure that the plan is in compliance with including all out-of-pocket expenses for members, so copays, deductibles, co-insurance amounts, and our prescriptions. Also, Wes indicated earlier, as a part of the wellness initiatives, monitoring that tobacco premium differential and making sure that we're seeing the return that we wish to see on that, but we're also in compliance with the Affordable Care Act and making sure that that's in lines with the guidance that's provided of how high we can set that threshold or that differential. Then also evaluating our plans for their minimum essential values. So looking at what value does that plan provide based on the plan design, deductible, co-insurance, how much is it projected to pay out, and then also the affordability of the plan, because these are things that we have to be in compliance with for the employer mandate. Our plan has to provide a 60% minimum actuarial value, and it has to be no more than 9.5% of an employee's income for our lowest cost plan, single coverage. So these are things as we work through this master plan, we continuously evaluate as we develop the plan design and the employee contributions for each. Making sure that we're providing the essential health benefits that are required under ACA. So these are maternity care, hospitalization, emergency services, and that they're included on all of the plans offered. And then also working through the ACA reporting requirements that come due March 31st for the 2015 plan year. This will be the first filing for any large employer groups, and so we will be working with Columbus Consolidated Government to file that, provide you with the data, and file that on your behalf to the IRS. So with that, we're reporting on any members that are enrolled in the plan for the 2015 plan year to illustrate any individual's compliance with the individual mandate, that they have health care coverage, but also that Columbus Consolidated Government is in compliance with the employer mandate and not subject to any penalties or fines. Any questions?
Yeah, let's see. We have Counselor Henderson.
Just a request. A lot of this stuff's way over my head, but I would love to know, like on the fees that are calculated, if you could just shoot us an email along with this, telling us how they're calculated, what impact we can have, and how they're determined, so that we'll know if there's anything we can do about them, or they just, we're stuck with them.
Okay, definitely. We can outline any fees that are currently in place and those that are pending to come into place.
This is great stuff. I would love to see something. I know I mean, the act was 100 billion pages, but if some of these key things that are going to impact us, if we could just have a little bullet sheet on what they are.
Okay, great.
That'd be awesome. Thank you.
All right, thank you. That concludes discussion and comment. Thank you all very much.
Thank you.
Very informative. Let's see, City Manager, Mr. City Manager.
Madam Mayor, with that, I am going to delay the other presentations scheduled, although they were going to be brief. I know it's getting late in the hour, and I'll delay those for a future meeting, and so that's going to conclude my agenda.
Okay. All right, we will head then into the clerk's agenda. Madam Clerk.
Madam Mayor and Council, on the clerk's agenda, items 1 through 7 are memorandums from me advising of the end-of-year board appointments, which we will be bringing back at our next meeting. Item 8 is a biographical sketch of Ms. Alicia Davis, who has expressed interest in serving on our Taxi Cab Commission. Item 9 is, this is a letter from Larry Young, our auditor. They're providing a report of the Columbus Department of Health 2015 financial statement and amendments. We have that complete audit on file in our office. Items 10, 11 are temporary street closing applications for various events throughout the city. Resolutions to excuse absences of our counselors.
Okay, we've got a motion to approve items 12 through 16, excusing counselors' absences. We have a second from Councilor Woodson. All those in favor, please state aye. Are there any opposed? Okay.
Item number 17, this is a letter of resignation from Ms. Tracy Belt, resigning from the Recreation Advisory Board.
Motion, is there a second? All those in favor?
And we also, item 18, we have another resignation from Mr. Bob Johnson, needs to be received.
Okay. With regrets, we have a motion from Councilor Woodson and a second from Mayor Pro Tem. All those in favor, please state aye.
And we also have a correspondence from the Keep Columbus Beautiful. They would like to change 2 of their seats. They want to move, and I apologize, I can't remember her name, from the at-large seat to the District 7 seat, and they want to put Dr. Kendall in the at-large seat. If Council does not have any objections of that, I know Councilor Woodson has been in contact with them, and she doesn't have a problem with that. And so if Council does not object, we can take a motion to...
Yeah.
Yes.
Okay, that's a motion by Councilor Woodson, second by Councilor Henderson. Any discussion on this item? All right, all those in favor, please state aye.
Minutes of various boards can be received.
Okay, we have a motion that the minutes be received. All those in favor, please state aye.
On our board appointments, on our Animal Control Advisory Board, Ms. Becky Carter and Mr. Timothy Butts have been nominated. They can be confirmed.
Okay, we've got a motion and a second to approve both Becky Carter and Timothy Matt Butts. All those in favor, please state aye.
And we are waiting to hear back from the Veterinary Association regarding Dr. McDermott. Board of Honor, Mr. Milton Hirsch has been nominated.
Okay, we've got a motion and second for confirmation. All those in favor, please state aye.
On our Convention and Visitors Board, Ms. Evelyn Harton can be confirmed.
We've got a motion and second for confirmation. All those in favor, please state aye.
On our Hospital Authority, Mr. Ernest Smallwood, Mr. Edward Gaffney's term will be expiring the end of November. They are eligible. We need 3 nominees for each of these seats from which the authority will select that member. Okay. I will. On our Land Bank Authority, Mr. Lance Hemmings, he is eligible. He would like to serve again if someone wants. Okay. We'll bring this back for confirmation at our next meeting. Keep Columbus Beautiful Commission, we've already handled that with Dr. Kendall. On a pension board, Mr. Joseph Smith has resigned, and this is the mayor's appointment.
Well, we have actually somebody who we're looking at, and I'll get back with you next time on that.
Okay. On our Region 6 board, Ms. Cynthia Smith has been nominated. She can be confirmed.
I have a motion and second for approval. All those in favor, please state aye.
And on our Taxi Cab Commission, as I've indicated, Ms. Davis is interested if someone would like to. Okay.
All right. We've got we need to bring it
We'll
back.
bring it back
Okay.
at our next meeting. And then we're still working to get someone for Mr. Kraft's seat. On our Uptown Facade Board, Mr. Rick Johnson, Mr. Doug Jeffcoat, Steve Morris, Scott Allen, and Fred Green's term will be expiring the end of this month. We're in contact with the Uptown Columbus to get those recommendations. And that's all I have, Madam Mayor.
Great. We have, let's see, Councilor Woodson.
Yes, excuse me. Just 2 comments. Stephanie Hayes, who was going to be here in our public agenda, unfortunately couldn't come because of a situation that appeared, and she sent me the information, and she wanted to invite council and everyone to the first annual Women to Be Born to Win benefit concert. And that benefit concert is a workshop, and it is with Crystal Rucker, Mia Jackman, Vivian Norman, and several other artists. It will be at I'm trying to look at this real quick. It will be on, give me one second, October 23rd at 6 p.m. at the Occasion Center. This concert benefit is to benefit some young ladies that need a lot of attention and help. And she urges everyone to please come out and worship and attend the concert. She's so sorry she couldn't be here, but a situation occurred with one of the young ladies that she's attending to. And secondly, if you don't mind, I would like a point of privilege. Just to let the council and our community know, unfortunately to us, but a blessing to him, Lefty, her Encarnacion, has moved on to our Father. He passed away this morning at 5:30, very peacefully, and his family and friends are in need of prayer. And the funeral arrangements will be announced later. His body was in Birmingham because he was going for a liver transplant, but unfortunately he didn't make it. And the body is being brought to Columbus as we speak. And just wanted to ask you, Mayor and Council, to please keep their family in prayer. They really need help. That family is going through a lot. His sister came to help Sunday to help with what's going on. And unfortunately, she came from California on Sunday and died on Wednesday in Columbus, Georgia. So that family is really going through some really, really hard times and needs a lot of prayers. And so just wanted to share with everyone that unfortunately a good community leader has gone on to meet our Father.
He certainly was that, and a very selfless person, and I appreciate you letting us know, Mimi, and do let us know about the arrangements as well as they are made. Thank you. Councilor Henderson.
Thank you, Mayor. I was just going to ask the clerk if when we get a notification of a resignation from a board, do they include a reason or some type of documentation?
Yes, they do.
Okay, I think maybe it'd be a good idea to put that in, because I noticed we had 2 resign from the Recreation Advisory Board, and I know there's no significance to that, but there may be a board at some point that there is some significance, and it's a little bit of insight into maybe some diverging of philosophies, and it might help us to have a heads up on that.
Councilor Henderson, those should have been included, and I do believe they indicated those reasons for that, but I'll get with you and get those to you.
Thank you.
Okay. Let's see. Councilor Barnes.
Yes, Mayor and Council and our community viewers, I'd like to let them know of 3 vets dealing with the veterans next month. One is the Chattahoochee Valley Veterans Organization is having the inaugural Veterans Banquet. It's the first banquet. General Miller will be the other commander of Fort Benning, will be the guest speaker. And point of contact for information is Commander Leroy Davis, commander of American Legion Post 135 at 706-718-4440. And that will be Friday, November 13th, 6 p.m. Then it's the Veterans Day Parade. That's Saturday, November 14th. You can get applications for the parade on the city's website, here at the Citizens Service Center, and also at Phoenix City Parks and Recs. General Miller will be the parade marshal and also the guest speaker at that as well. And on the 15th, the Sunday, there will be the second annual citywide Veterans Service at St. Mary's Road United Methodist Church. Point of contact is Miss Pat Liddell at 706-565-0637. Please come out and support our veterans.
Okay. We've had a request for a short executive session on a pending litigation matter. Is it time sensitive, Clifton? Do we need to? Okay. All right. All those in favor of going into executive session, please state aye. Okay. Please clear the room.
I'm sorry, who made that motion?
No.
Thank you.
Okay. Sorry about that. Okay. If you would please clear the chambers. And let's go quickly if you can. We've got
Nancy.
All right, we are back from executive session on a litigation matter where no votes were taken. I believe Councilor Barnes had a point of privilege. Yes.
Actually, it's a question my wife asked.
Okay.
I'm not on.
Whoops. Okay, there you go.
It's a question. My wife asked me, now we didn't get our tree limbs and all picked up yesterday. So Jamal, when they're not ready to get picked up on any day or on Monday, when will they come?
Your day will be on Wednesday.
On Wednesday. See, I love that commercial. I told my wife to watch the TV. Right, you do an excellent job. So my wife would get it. I told her on Wednesday. I wanted you to tell her. Thank you so much.
That's great.
That's an excellent commercial.
So your trash will be picked up on Wednesday if it wasn't. We don't have a quorum to adjourn, so I will just I will declare us adjourned, and we will see you back hopefully with a quorum in the near future. Thank you.